Hello and welcome back. I'm Dr. Akhilendra Singh Parihar, and today we are going to talk about something very important, and that is the amount of harm being done to children with asthma, not by the disease, but by misinformation around it, by myths, by stigma, by well meaning parents who are so afraid of an inhaler that they withhold it from a child who desperately needs it. So, today we are going to go through the biggest myth about childhood asthma, and I mean the ones backed by uh, uh, published literature, high quality observational studies, and systemic reviews. We are not just going to debunk these myths with opinions, but we are going to debunk them with science and with evidence. Let's go. First, myth number one around asthma is if my child starts an inhaler, they will be on it forever. It's addictive. This is very common. I hear this every single week in my clinic, and I understand where it comes from. It comes from a place of love and fear, but we need to address it directly. So, inhalers, specifically inhaled corticoid steroids, which are the preventer or maintenance inhalers, are not addictive. Full stop. They do not create physical or psychological dependence. What they do is reduce the airway inflammation that is causing your child to struggle to breathe. There are many published researches, which includes also some RCTs, randomized controlled trials, which confirms that daily inhaled corticosteroids are preferred first line controller therapy for preschoolers and toddlers who are having recurrent wheezing episodes. And here is the key point: when a child sustained good control, then therapy is stepped down and eventually it is stopped. The goal has always been to get the child off the medication, but you cannot get there if you never treat the disease properly to begin with. Now, myth number two, and this one is responsible for many preventable hospital admissions. The steroids in the inhaler will stunt my child's growth. There is a landmark systemic review and a meta-analysis of about 20 randomized control trials, which are very good quality, looked at this question directly. And what was the result is inhaled corticosteroids used for more than 12 months showed a mean reduction in final adult height of approximately just 1 centimeter. 1 centimeter. Now, what you think about that for a moment? We are talking about 1 centimeter over a lifetime compared to the recurrent acute asthma attacks, compared to oxygen deprivation, compared to emergency department visits, ICU admissions, and in the worst cases, death. And these uncontrolled asthma causes far more harm to the developing child than a 1 centimeter difference in the height. And sometimes due to chronic infection and asthma they will be stunted by disease itself. And yet studies from many countries all show the same thing: parents withhold inhalers because of the steroid fear. One observational study, found out that only 38% of parents were aware of the actual safety data on inhaled steroids. So, steroid phobia is the single biggest barrier to inhaler acceptance, identified in around 58 to 70% of parents in some studies. We have to change this particular narrative. Now, myth number three: the nebulizer machine is more powerful. My child needs the machine, not just an inhaler. So, this comes up so often, especially in our country, India. Parents see the nebulizer, the machine, the mask, and the mist coming out of it, and they think it must be delivering more medicine and better medicine. But the evidence simply does not support it. And clinical guidelines, which are backed by many systemic evidences, confirm that meter dose inhaler, your inhaler, used with the correct spacer device, is far more effective as compared to a nebulizer for delivering inhaled medication to the airways. In fact, for home use, the MDI with a spacer is preferred because it is faster, more portable, has lower infection risk, and delivers the drug more reliably to the lungs when used correctly. The nebulizer is an important device in a specific setting, specifically in ICUs. But the myth that it is somehow superior to an MDI for routine use at home is simply incorrect. Now, coming to the myth number four: my baby is only 2 years old. Surely they are too young for an inhaler. So answer is simple no, not at all. Inhalers are used safely in infants even under 12 months of age when these are paired with an appropriate spacer and appropriate sized face mask. Guidelines from American Thoracic Society and GINA and European Respiratory Societies, all these guidelines confirm that children aged 3 to 5 year can begin with MDI with a spacer alone. And for younger children and infant, we simply add a face mask to the spacer. The inhalation route is actually the preferred route precisely because it delivers medicine directly to where it is needed, the airways, while minimizing the amount that enters the bloodstream, which causes the side effect. That means fewer systemic side effects and not more. The inhaler is actually the gentler option compared to the oral medications. Now, I want to spend a little extra time on this one because it doesn't get talked about enough. So, what is myth number 5? Using an inhaler in public is embarrassing. I don't want my child labeled as sick and I don't want them using it at the schools. This stigma is real. It is documented in many literatures. Many qualitative systemic review published found that patient, including adolescent, described hiding their inhalers, avoiding doses in public, and feeling a loss of identity connected to their diagnosis. They felt embarrassed. They felt different. And here is the devastating consequence. A cross-sectional study of around 300 patients with confirmed asthma found that inhaler-related stigma was statistically significantly associated with poor adherence to the therapy. Now, this stigma leads to missed doses lead to uncontrolled disease, and uncontrolled disease leads to attacks, hospitalization, and worse long-term outcomes. So, a study in UK, adolescents with asthma found that social stigma was one of the most prominent and most underestimated barrier to the proper inhaler use. So we need to change the culture around this. And many many elite athletes and Olympians use inhalers, and they are very good at their particular sports. So an inhaler is not a sign of weakness; it is a tool. It is like wearing glasses if your vision is impaired. Would you tell your child not to wear their glasses because it is embarrassing? Of course not. Okay. So coming down to the myth number 6, asthma is psychological. My child panics and makes it worse. So asthma is a chronic inflammatory airway disease. It has a well-characterized biological mechanism, eosinophilic inflammation, airway hyperresponsiveness, mucus secretions, and bronchoconstriction. A large meta-analysis also found that even airborne pollen exposures alone, a purely environmental trigger, significantly increases the risk of childhood asthma with an odds ratio of 1.23, which is significant. The disease has real measurable biological causes. Anxiety may worsen the perception of breathlessness, but it does not cause asthma. Now, myth number 7, my child will grow out of it anyway, so why treat aggressively now? Some children do achieve remission, that is true. But research shows that preschool Vs persisting beyond 18 months of age is a significant risk factor for asthma, reduced pulmonary function, and persistent airway inflammation into adulthood asthma also. The inflammatory process during these critical developmental years can cause permanent airway remodeling. So we treat now to protect lung function for decades to come. So it is very important to treat asthma at this level. And myth number 8, I think it is most dangerous one. The blue reliever inhalers is enough. We use it when she struggle and she is fine. So the reliever inhaler, the short acting bronchodilators, these opens the airway. That is all they do, but it does nothing to treat the underlying inflammation, which is the root cause. So using only a reliever while avoiding the preventer or maintenance therapies like switching off a smoke alarm instead of putting out the fire. So the guidelines are now very clear. Inhaled corticosteroids are the recommended first line controller treatment for children with persistent asthma regardless of age because they address the root cause of the disease. So over reliance on the reliever is actually one of the warning signs that asthma is dangerously uncontrolled. So to summarize, inhalers are not addictive. They will not permanently stunt your child's growth. Metered dose inhaler with a proper spacer is as good and better compared to the nebulizers. Now, toddlers and infant can safely use inhalers, and the stigma around inhalers is real and harmful. Asthma is biological, not psychological, and untreated early asthma can cause permanent damage to the lungs of the child. And the reliever inhalers alone is never enough for a child with persistent disease. So, if you take one thing away from this video today, please let it be this: the inhalers is not the enemy, the untreated asthma is. If you found this helpful, please share it, especially with the parents of asthmatic children, and especially in communities where these myths are widespread. So, you might be sharing something that prevents an emergency. Please like, subscribe, and I will see you in the next video. Thank you.